Did Coca-Cola buy their way out of culpability in obesity? Oh yeah, they sure did. And you're going to find out the details here today on Jimmy Rants. JimmyRants.com is the website. And as always, we start right here on Instagram. So if you're not following me already, hop on over to Instagram. Type in the username Jimmy Rants, all one word, JimmyRants. And you can follow this show. We go live Monday through Friday, 11 a.m. Eastern Time, right here on at Jimmy Rants. We also have the episode available on replay over on IGTV. So as soon as this show is over, it will go right up onto IGTV here on Jimmy Rants. We also put the past episodes up over on YouTube, which we are simulcasting on over here, live stream. What's up, YouTubers? We're also simulcasting, by the way, on my Facebook channel. So go check those out as well if you missed the live. And then finally, no matter what happens with all the censorship going on out there, we will always have the past episodes of Jimmy Rants available for you at the official website for this show. It is JimmyRants.com. So go check out the past episodes there. We try to be here with brand new information every single day during the week. So Monday through Friday, 11 a.m. Eastern Time. Thank you guys so much for being here today. Okay, so today I wanted to talk about a topic that I kind of briefly mentioned a couple of months ago on a Jimmy Rants episode. And we know the powerful impact that big business, big food, big pharma, all these corporations that have lots of money, we know the indelible impact that they have on so many aspects of our society. We're seeing it right now with big tech. They're able to control a lot of information that we're allowed to see and not allowed to see. And so it makes sense that as these companies get bigger, as these various entities are able to flex their muscles, so to speak, both with the power they have over you through the products and services that they offer, but also the financial means that those products and services have afforded them, we know that they can try to institute changes that they want to see happen. And that's what we're seeing in big business when it comes to research. Now, I did a Jimmy Rants, like I said, a few months ago about the really in-depth fingers and tentacles of big business being in the business of funding research. And that particular one, I'm trying to remember, I think it was Coca-Cola as well, but there's been many companies that do this, where they fund research. They give grants to these companies, to these universities, that say, hey, we want to see a positive outcome for our particular product. And so here's a big wad of money. Go do the research and show the research we want to see. The example I gave you recently was where I read from a study about the Beyond Meat burgers and the plant-based burgers, how they were better than beef burgers. And then you saw that the money came from Beyond Meat. And so when you see that kind of connection with industry and science, the lines get blurred as to, okay, is this legit, or did they kind of pull the wool over people's eyes? Well, I have a brand new study today that came out. I'll be reading from the study here in a minute, published in the International Journal of Environmental Research and Public Health. Just a few days ago, it was published December the 3rd. So I'm going to read from that here in a minute, but I have a story about it first. Where Coca-Cola, once again, has their grubby hands in the subject of obesity. Now, any of us who have been in the low-carb, keto, paleo, carnivore, real food movement, we have long wondered why there isn't more fingers pointing at soda as a big reason why people got fat. I can tell you from my own experience that before I went on the Atkins diet, I actually used to drink, and this is no lie, you guys, I used to drink 16 cans of Coca-Cola a day. 16 cans. And I was an addict. I had so much desire to drink those and drink them in high quantities that I couldn't stop myself. And it wasn't until I went on a low-carb diet that I was able to eventually, it took a few months to break that addiction of really wanting those for me to overcome it. And I know a big reason why I got to be 410 pounds at one point in my life was that addiction to Coca-Cola. So now we have a story, we have a study that came out that finds Coca-Cola was actually funding public health conferences in an effort to blame somebody else for obesity, according to this new study. So let's read this article. It's a news release about the study. The Coca-Cola Company used its sponsorship of international public health conferences to deflect blame for the obesity epidemic away from its products, according to a study in the International Journal of Environmental Research and Public Health. Can I just tell you, big food has no business being involved in public health conferences. None. But if you go to any dietetics association conference, you go to a lot of these health conferences, you got Coca-Cola's fingerprints all over it. They are trying desperately to be able to basically say, hey, look, we're in the health discussion. We think Coca-Cola is part of a healthy diet. If you ever see on a soda machine, we care about your health and count your calories. They talk about calories a lot within the context of drinking Coke, but that's all they have. If you are basically all high fructose corn syrup, which is what Coca-Cola is, 45 grams in a can of Coca-Cola, 45 grams of high fructose corn syrup sugar, divide that by 4. That's over 11 teaspoons of sugar. And your body has 1 teaspoon of sugar. So just with 1 can of Coca-Cola, you're flooding your body with 11 times the amount of sugar that it needs. Now keep in mind, I used to drink 16 of those every single day and didn't think twice about it. So what in the world do we have Coca-Cola being involved in sponsoring anything related to public health? Well, this study reveals why. The study is based on documents about the 2012 and 2014 International Congresses of Physical Activity and Public Health. It was obtained via state public records request by a U.S. Right to Know and investigative public health group. The study found that Coke deliberated with its sponsored researchers on topics to present at these conferences, despite publicly claiming otherwise. Did you catch that? So when they were asked, hey, we see you're sponsoring these 2 big obesity conferences, did you have any kind of inkling of telling them what they could say and couldn't say at this conference? They said no. But now in these emails, they found they actually directed the topics that they were allowed to talk about. The reason they did this was an effort to shift blame for the rising incidence of obesity and diet-related diseases away from Coca-Cola products and on to physical activity and individual choice. So here's what they're telling you, fatty, big fatso, big obese. It's all your fault that you became obese. It's all your fault because you made bad choices. It's all your fault because you refused to engage in physical activity that could keep your weight under control. That is what Coca-Cola was getting these obesity conferences to say. Is that not disgusting? Is that not sickening to think that here is a company making a product that everybody universally knows without a shadow of a doubt is incredibly unhealthy for you? And yet they're saying, nope, it's all your fault. You don't exercise enough. You don't cut your calories enough. It's all your fault, fatty. Anybody else insulted by that? Anybody else wondering, okay, no culpability at all, Coca-Cola? Really? None? Coke used these conferences to promote its front groups and sponsored research networks and to foster relationships with public health leaders in order to use their authority to deliver Coke's messaging. I did a Jimmy Rants a few months back talking about how they did that with the dietary guidelines. You might remember this story, but early on when the dietary guidelines were first being created in 1980, there was one of these front groups created, and the front group was created to infiltrate the Dietary Guidelines Advisory Committee starting in 1980. And do you know, in 2020, we still have members of the Dietary Guidelines Advisory Committee that are from this front group from Coca-Cola. Over half of the members of the Dietary Guidelines Advisory Committee in 2020, over half of them were a part of this Coca-Cola front group. So what do you expect? Like, they're hitting this from all angles. They're doing it from that realm with the dietary guidelines. They're doing it from obesity conferences and public health conferences. And they're saying, oh, individual responsibility. They need to be exercising more. They need to be watching their calories better. It's not our fault. We just have a product. I don't know how they can keep that up, because I think it's obvious that they play a role, if not the role, along with fast food and along with other junk food companies that are out there. This unseemingly conscription of public health conferences to serve up Coca-Cola's messaging erodes the trust in the cause of public health. According to Gary Ruskin, the executive director of U.S. Right to Know, it's long past time for the public health community to transform itself into something that cannot be bought or rented. Absolutely. Why would we allow business entities to enter the discussion of public health? And I think it even includes business entities that are in the diet industry. Like Coca-Cola, yeah, they sell Diet Coke and Coke Zero and some other diet-related type products, but they're most well known for their sugary swill. Why are we letting them involved? But even like, I wouldn't want Slim Fast to be involved. I wouldn't want Weight Watchers to be involved. They don't have any business being involved in that because they have a financial interest. I think when it comes to public health conferences, we need the science to shine. We need those people that are doing quality research to amplify what they've found, any new discoveries, that kind of thing. That's what's so sorely needed, not big business. Now, I realize these conferences cost money to put on. They have to get funding from somewhere, but can you get it from somebody besides Coca-Cola? Like, I can think of a million other companies, if you're going to use companies, to help fund these things. The documents show that Rona Applebaum, that's the Coca-Cola's chief science and health officer at the time, remember it was 2012 and 2014, wanted to focus attention on individual behavior and motivation, which is far removed from government or collective action, such as putting a tax on sugar and soda, crackdown on soda advertising and marketing, litigation against soda companies, and other policies. So again, this whole, it's all on you. If you drink Coca-Cola and you get fat from it, oh well, that's your choice. You chose to do that. And I can hear people make that argument, and I have heard over the years of doing this online, I have heard many a times where they're like, well, you know, they didn't force you to eat it. They didn't force you to drink it. They didn't force you to do all those things. And I think it's a little bit of a fine line there. I'm definitely a big believer in people having personal choice and personal responsibility. Huge believer in that. But at some point, if these companies are using their influence, using their money to affect policy and affect conferences that then trickle down to doctors who then trickle that information down to their patients, it does impact me. If they were just innocent bystanders just making a product available for people to purchase or not purchase, that would be fine. I'm okay with that. Where they got into trouble, which is what this study I'm about to read to you is about, where they got into trouble is where they used the profits from that in order to try to hide their true culpability in the obesity epidemic. The process of generating and disseminating public health related research needs to be better protected from the influence of firms with interests that are clearly in conflict with those of public health. According to Benjamin Wood, one of the co-authors of this study, one step to achieving that is to eliminate all forms of sponsorship from firms active in health-harming industries. Well, there you go. We're going to have a bit of a discussion on that, because if they do eliminate all forms of sponsorship from firms active in health-harming industries, who gets to decide what is health-harming and what is not? Will there be some kind of a committee that determines that? Because if you ask a vegan if there's something health-harming and the National Beef Association wants to put their money into some conference, the vegans are going to call foul on that. F-O-U-L, not F-O-W-L. They're gonna basically say, well, wait a minute, that's not health promoting, that's health harming. And so who will get to determine that? I mean, it's going to be an interesting discussion to see if that gets traction. So the study, we'll get to it here in a minute, was co-authored by Benjamin Wood, a medical doctor and PhD candidate at Deakin University, Gary Ruskin, and Associate Professor Gary Sachs from Deakin University. The paper argues that the dissemination of scientific knowledge through scientific conferences should be better protected from hidden and less visible forms of corporate influence. I would think that if you're going to put on a conference about public health, and I've been to some of these conferences, by the way, obesity conferences, public health conferences, I've been to them. And I have participated as a layperson, just kind of observing. And what I found was a lot of pharmaceutical companies, heavy funding from pharmaceutical companies. I've also seen a lot of food companies involved. I mean, special interests galore are involved. And so if they're going to be involved, you know they're not there for kicks and jollies. They're there for the purposes of making their products look good, or at least not look bad. You see what I'm saying? And so if they're going to use that money, I think it behooves them to let the general public know, hey, look, this conference was sponsored by Coca-Cola. This conference was sponsored by Pfizer. That would be good information to know. Otherwise, how do you know that what's disseminated at that conference isn't tainted? You're going to assume it was not. But if you know Coca-Cola paid for the sponsorship of that conference to take place, you got to know there's going to be some influence there. Now, Coca-Cola can balk, and they even did, as we'll get into in the study here in a minute, they did say publicly, oh no, we had no influence whatsoever about what they're allowed to say at this conference. We all know that's crap. But they said it publicly. No. Well, now we have the emails in this study that prove otherwise. The model of eliminating tobacco industry sponsorship as stipulated in the Framework Convention on Tobacco Control could be applied to the food industry. So we already have an example of this where the tobacco companies did the exact same thing as the food companies are now. Back in the day, they sponsored a lot of health conferences, and then they passed this Framework Convention on Tobacco Control. They could do a Framework Convention on crappy garbage control. They could do it. All right, so let's get into the actual study itself. And again, if you joined us late, yes, there is a brand new study taking a look at some emails that was basically they got from a subpoena in them and trying to get them to see what was said, because Coca-Cola claimed they had no culpability in how these public health conferences were conducted in 2012 and 2014, but emails show that they had a heavy hand in it. So Coca-Cola got caught funding public health conferences, trying to shift the blame of obesity away from their products and onto you. It's all your fault that you got fat. You need to take personal responsibility. You need to get off your fat ass, go exercise. That's what they said. And that's disgusting. All right, so let's get into this. There is currently limited direct evidence of how sponsorship of scientific conferences fits within the food industry strategy to shape public policy and opinion in its favor. This paper provides an analysis of emails between a vice president of the Coca-Cola Company and prominent public health figures in relation to the 2012 and 2014 International Congresses of Physical Activity and Public Health. Contrary to Coke's prepared public statements, the findings show that Coke deliberated with its sponsored researchers on topics to present at the conference in an effort to shift blame for the rising incidence of obesity and diet-related diseases like diabetes, heart disease, cancer, away from its products onto physical activity and individual choice. The emails also show how Coke used the conferences to promote its front groups and sponsored research networks, as well as to foster relationships with public health leaders in order to use their authority to get Coke's message across. This study questions whether current protocols about food industry sponsorship of scientific conferences are adequate to safeguard public health interests from corporate influence. And then they talk about the Framework Convention on Tobacco Control, how we could do something like that to the food industry. So again, the title of the study, How Coca-Cola Shaped the International Congress on Physical Activity and Public Health, an analysis of email exchanges between 2012 and 2014. This was published in the December 3rd, 2020 issue of International Journal of Environmental Research and Public Health. All right, so let's get into the introduction. The processed food and beverage industry, herein we will call the food industry, has been identified as a major contributor to the global burden of obesity and diet-related diseases, things like type 2 diabetes. A growing evidence base highlights how the food industry attempts to shape public policy and public opinion in their favor, and concern has been raised about how the political influence of powerful food and beverage corporations poses a substantial challenge to public health efforts to prevent diet-related disease and improve population diets. All right, pause. I've talked about this before, that when industry dollars enter the research and scientific realm, how does it not have an influence? How do those researchers that get money, and I talked about this before on previous Jimmy Rants, how if you get a $250,000 grant from Coca-Cola, for example, how do you do a study that makes Coke look bad in any way? Like, it's the whole don't bite the hand that feeds you kind of thing. And I don't know what the answer to this is, because these educational institutions that are doing research, they have to fund their lab. And so the NIH, National Institutes of Health, only has so much budget to pay for studies. They do pay for quite a few, but they only have so much budget. So what are all these other universities supposed to do? They have a research lab. They have to beg, plead, anybody. And there's a few individuals that donate money, and they say, do with it as you want, to do the study you want. But more times than not, they're left with no other choice but to go to these corporations. And then the corporations will have an expectation. Let's stop pretending like they're just going to hand over a big wad of money and not expect some outcome. Like, from a logical standpoint, why would Coca-Cola give money to a research facility to have them do a study about the deleterious effects of sugar on the body? Because is that going to make Coca-Cola look good? No, just the opposite. So they're giving the money. They've got the money because of many years of being allowed to make money under the guise of, it's just about calories, so just keep it within your calories and calories and calories. And now we realize calories weren't the be-all, end-all. All along, we should have been looking at sugar. We should have been looking at refined carbohydrates. But just now is when that's happening. They've already made so much money. They've got money in the coffers, and they're just dying to throw it at all these institutions, conferences, public health leaders, researchers, to get them to say what they got to say to keep Coca-Cola from being culpable for obesity. You see how it's all interconnected? One of the key political strategies of the food industry involves shaping the evidence and framing the debate on public health issues in ways that favor corporate interests. This is why we still talk about calories. Do you know, if we didn't have money coming in from food companies, that this whole calorie nonsense that we still live under would probably be gone by now? We would be talking about the impact on blood sugar. We would be talking about insulinogenic effects of food. We would be talking about inflammatory impacts of foods. That's what we would be paying attention to if there was not this heavy-handedness from companies like Coca-Cola being involved in framing the discussion of public health. There's no doubt in my mind about it. Because otherwise, why would they still vilify saturated fat? Why would they still be focusing so intently on calories? They wouldn't be. This discursive strategy of the food industry is similar to what the tobacco industry did. Scholars examining the strategies of the tobacco industry have shown how for decades they denied the association between smoking and lung cancer, and they continue to use a number of the tactics to shift policy debates away from the health implications of smoking. Well, if they're using the same tactics as the tobacco industry, what happened to that industry? Oh, they got hit hard. There's a big warning on every single pack of cigarettes. U.S. Surgeon General says this could be harmful to your health and cause lung cancer. You're not allowed to advertise cigarettes on television. Like, they put some pretty major restrictions on these on this product because of their deleterious effects on health. Why can't we have some kind of warning thrown on a can of Coke? How hard would it be for them to be forced to put a very prominent warning label? This product could cause obesity, heart disease, diabetes, and even death. They should. And they should be banned from being able to have commercials on television, just like the tobacco industry. Tell me where I'm wrong in this. If they're going to use the same tactics as the tobacco industry, why not get the same result that happened to the tobacco industry? Makes sense to me. The Coca-Cola Company is the largest global manufacturer of sugar-sweetened beverages. They've been linked to increasing rates of diet-related disease at the population level. Recent work has uncovered a number of tactics that Coke has employed to shape the evidence and frame the debate on diet and nutrition-related diseases. These tactics include sponsorship of academic research, which I was just talking about, the sponsorship of front groups. So here are some of the front groups. If you ever hear this in the media, these are the Coca-Cola front groups. International Life Sciences Institute. Sounds so beautiful, right? The International Life Sciences Institute. That's Coke. Global Energy Balance Network. Oh, who doesn't want global energy balance? Oh, yeah. That's Coke. This is a funny one. Exercise is medicine. Does that sound anything like Coke? Well, if it doesn't, it is. Those are all front groups that they use to sponsor conferences. The fostering of close relationships with various authoritative public health institutions, including the Center for Disease Control. And they influence medical and science journalists. So they know everybody. They got their fingers deep into every little industry that could have an impact negatively on their bottom line. And so if you're buying basically favor from all these groups and organizations and individuals, yeah, you can kind of shift the culpability in obesity very easily. And they use that money in that way. To date, however, little research has examined how the food industry uses its sponsorship of public health conferences as a platform for their messaging strategy. This is despite the fact that the processed food industry sponsors and participates in many diet and nutrition-related public health conferences. I don't think the general public even realizes that most of the news we hear out of public health conferences are heavily influenced by industry. Why would we? Why would we know that? If I had not attended some of these conferences myself, I wouldn't have even guessed that. So when you hear, well, at this public health conference, they concluded and found well, you got to know, okay, Coca-Cola had a part to play in how that information was disseminated. So in light of this gap, this study aims to provide direct evidence of how Coke used its sponsorship of the 2014 and 2012 International Congresses of Physical Activity and Public Health as a platform to advance its commercial interests. This was achieved through the qualitative analysis of internal email communications between a senior exec at Coke and a number of prominent health figures, public health figures. Okay. So the materials and methods of this study in 2015 and 2016, the nonprofit consumer and public health research group called U.S. Right to Know filed 4 state public records requests. Sometimes they're called a Freedom of Information Act, as part of a wide-ranging investigation into the food industry's influence over matters related to public health. These requests were via the Colorado Open Records Act, the Louisiana Public Records Act, the West Virginia Freedom of Information Act, and the South Carolina Freedom of Information Act. As part of these public records requests, U.S. Right to Know sought communications between university faculty and Koch for the period between 2012 and 2017. In response, they got 36,931 pages of documents. I feel sorry for the person that had to pore over all of those. The documents were manually screened by one of the authors in conjunction with a coworker for evidence of food industry influence related to public health policy and practice, including food industry sponsorship of scientific conferences. During the manual screening, 7 documents that made reference to Koch's sponsorship were identified. So they went through almost 37,000 pages worth of documents to find 7 documents. God bless them. I don't know if I would have the tenacity to do that. Well, this was 2017, and it's just now 2020. It took them 3 years to get through all that, so more power to them. Only the emails that involved direct communication between Koch staff and public health researchers were included in the analysis, which was 5 out of the 7. Each of the 5 emails included Dr. Rona Applebaum. She was then the vice president and chief health and science officer of Koch. The public health researchers included in the emails, all of whom received funding from Koch. Listen to these names. If you ever see a research paper from any of these names, know that they got money from Coca-Cola. Stephen Blair, he's a professor at the Departments of Exercise Science and Epidemiology and Biostatistics at the University of South Carolina. He's the co-founder of Global Energy Balance Network, which is, remember, the Coca-Cola front group, then vice president of Exercise Medicine, another Coca-Cola front group. Kenneth Fox, a professor at the University of Bristol, Center for Exercise, Nutrition, and Health Sciences. Peter Kaczmarzyk, that's the co-principal investigator of an organization, ISCOLE. Timothy Church, the co-principal investigator of ISCOLE. James Hill. Now, if you don't know anything about researchers, James Hill is a big name. James Hill is the one that has been pushing calories. It's all about the calories. He's done that for as long as I've been around, which is over 15 years. He was already very well established and very well known in the research realm. Dr. James Hill. He's a professor at the University of Colorado, and at the time of these emails, he was the president of the Global Energy Balance Network, again, the Coca-Cola front group. John Peters, a professor at the University of Colorado. He was then co-vice president of the Global Energy Balance Network. One email exchange also involved this gentleman named Pedro Halal, an associate professor of epidemiology. He was the chairman of the 2014 ICP-APH in Rio de Janeiro. So that's the big conference that we were talking about. That's what those letters are. The email exchanges occurred between 2012 and 2014, and they were in reference to either the 2012 event in Sydney, Australia, or the 2014 event in Rio de Janeiro. The email exchanges also referred to the Exercise is Medicine, which is a Koch-sponsored study that is one of the largest multi-country studies examining factors that contributed to childhood obesity. It's a global partnership in which Koch is a founding partner that is managed by the American College of Sports Medicine. It promotes the idea that physical activity is integral in the prevention and management of the majority of medical issues. How many of you guys believe that? And you've probably heard that. Oh, physical activity. And you probably heard it from your doctor. Here's the saddest part about all this. At these public health conferences, you've got researchers, you've got medical doctors, you got people in the medical industry attending. So they're hearing, oh, obesity really isn't about your diet, because your diet, you just count your calories, keep the calories in a good place, and you're good to go. exercise is really where it's about. And so if you want to make a shift in obesity, you want to make a shift in your health, you need to be incorporating exercise. That's what they're telling us. And so that's what they were trying to promote at all of these conferences, is that it's about physical exercise and physical activity as the key to controlling obesity and the related diseases. I'm sorry, but you can't do that. Like, nutrition, I would argue, is the foremost thing you can do for obesity and obesity-related diseases. Exercise is important, don't get me wrong, but let's not put the cart before the horse. You can't out-exercise a bad diet. If your diet sucks, you're not going to get the results that you want in your weight and your health. You're just not. We read all the included emails in chronological order in a similar fashion to other research that has analyzed internal food industry communications. We use thematic content analysis to code the data. Themes were selected using a deductive approach based on a well-established framework for examining corporate political activity. This activity framework that we use describes 6 strategies used by the food industry in their effort to influence public opinion and public policy to serve their own commercial interests. These are information and messaging, financial incentives, constituency building, legal strategies, policy substitution, and opposition fragmentation and destabilization. Within each of these strategies, the food industry has been observed to use a number of different practices further its corporate interests. Aspects of this framework were relevant to the study are outlined in a table, which they give a table here. Data from the emails were supplemented by documents detailing the scientific programs and the abstracts that were submitted to these 2 conferences in 2012 and 2014. They were sourced using Wayback Machine. So if something's gone from the internet and you want to find it, go to Wayback Machine and it can find things that have been on the internet. It keeps it there. So it archives past websites. That's how I have found old blog posts, even though my blog no longer exists. I can use the Wayback Machine and go way back to the very beginning and see those posts. All right, so what were the results of all this examining? 5 email exchanges that were sent between February of 2012 and June of 2014 were analyzed. The email exchanges highlight how Koch set out to influence the scientific agenda of those 2 conferences. In addition, the email exchanges support the notion that Koch used those conferences to promote the front groups and research networks that it sponsored and to establish relationships with key public health leaders and organizations. I'm not putting all the blame on Koch here. These researchers, these people, these public health officials, they had to know who they were getting into bed with, because I'm sure it was already well known behind the scenes, hey, shh, if you play ball, they'll give you a boatload of money. And again, a lot of these research labs, they are desperate for money, desperate to fund their work. Otherwise, they have no money to fund their work. They have no work. And so to them, it's better to do work with a bias than to have no work to do and be out of a job. Do you see how we have put these researchers in a predicament that they are feeling like they have no other choice but to play the game? And so they have a list here of the 5 different email exchanges that were analyzed. February 9th, 2012, Rona Applebaum and Peter Kaczmarczyk. And it was about the abstract submission for the 2012 conference. November 8th, 2012, Rona Applebaum with James Hill and John Peters. Koch's PR messaging, that's where they told them this is what we want to see in the 2012 conference that we're sponsoring. October 20th, 2013, Rona Applebaum, Peter Kaczmarczyk, Timothy Church, and Stephen Blair, research and session ideas about the 2014. So then November 3rd, 2013, Pedro Halal, Rona Applebaum, and Peter Kaczmarzic's planning of one of the sessions at the 2014, and then June 13, 2014, Rona Applebaum, Peter Kaczmarzyk, and Timothy Church, response to a paper in The Lancet about Coke sponsoring. See, they were already on to them at that point. Coke sponsoring the 2014 Public Health Conference. They were already on to them, and they're like, we got to get ahead of this. And so they were talking about that behind the scenes as well. In one of the emails from 2012, Applebaum shared an internal memo with Coke-sponsored researchers containing messaging and talking points about Coke's involvement in the 2012 conference. In this memo, Coke wanted to make it clear that we have no involvement in the deliberations about the agenda, topic areas, and speakers. When we host scientific symposia in conjunction with an event like this, our role is to invite the experts, reimburse them for their travel and expenses only. We do not have a role in their topic of choice or the information they choose to present. Blech! Like, there's no way they can expect people to believe that with a straight face. Otherwise, what's their point? Out of the goodness of their heart, they're just going to throw this money at them? No. But in these email exchanges that they're highlighting in this study, it challenges the veracity of that statement in their public relations statement that Coke made. They show that Applebaum was involved in deliberations specifically on the topics to be presented by Coke-sponsored researchers at both the 2012 and 2014 Public Health Conference. Specifically, Applebaum pushed for the dissemination of research on topic areas that shift blame away from the role of the food industry and its products in contributing to diet-related diseases. In an email relating to ideas for abstracts to be submitted for consideration to the 2012 program, Applebaum wrote to Professors Fox and Blair, encouraged them to consider submitting abstracts on behavior change and energy balance, that's calories. It can be seen that Applebaum's recommendations were indeed implemented by the researchers. A review of the 2012 scientific program revealed that Fox presented a talk about using self-determination theory to promote physical activity. And Blair presented a talk during a Coke-sponsored session called "We Will Never Understand the Obesity Epidemic or How to Deal with It Unless We Better Understand Energy Balance." So you see how they were shifting the blame away, trying to say, well, Coca-Cola fits within a calorie-restricted energy balance type of diet, so it's on the table, it's okay, there's no culpability in obesity, and if there is, it's all your fault for drinking the Coke. They thought they could get away with that. They thought nobody would ever do a Freedom of Information Act and actually look up and see that what they stated publicly is not what they did behind the scenes. In an email exchange discussing topic ideas prior to the 2014 event, Applebaum asked Professor Blair, "Do you think another major source of bias in these studies," talking about epidemiological studies of body weight and mortality, "is that most of them completely ignore the physical activity, or if they mention it, use very flawed and inaccurate physical activity data? Why not have a session that addresses this specific point?" In that same email exchange, it included researchers Church and Kaczmarz. Applebaum wrote, "Obviously, the key to all of this," referring to the topic ideas for the 2014 conference, "continues to be the focus on individual behavior and their motivation." Ideas? This is a piece of work. Like, for them to shift all the blame for obesity, all of it, onto individuals with no culpability whatsoever on their part. Again, I think people do have the right to choice. I do think they should be responsible and have consequences for their choices. But if you're going to be intricately involved in public health conferences, which then influence the doctors, who then influence you as the patient, that's off the hook. Like, you can't do that and it not expect for us to call you out on that. Again, sell your sugary swill, do what you got to do, but don't use money behind the scenes using front groups to infiltrate these public health conferences, pretending like you're about health, promoting people having individual responsibility and increasing their physical activity. It's insulting. Stop it. I love that this is getting out there, Because now, if I'm a public health conference and Coca-Cola comes to me and says, hey, want to give you some money for your conference, you're going to be like, yeah, we're gonna pass. Because this is going to hit them hard. There's too much negative press from this. Applebaum also asked for potential topic ideas that could be based around the 2013 International Olympic Committee's consensus statement that focused on physical activity and behavior change. Lastly, based on the brilliance of this consensus statement, any thoughts or ideas catalyzing around the 5 strategies we can go a deeper dive on, focusing on the physical activity. The 2014 scientific program revealed that Professor Blair was the co-author of an accepted abstract that stated in the conclusion, the results support our hypothesis that high energy expenditure related to high levels of physical activity rather than low energy intake related to food consumption is the gateway for weight management and obesity prevention. So if you become frustrated that it seems like we've had more emphasis on just exercise to the exclusion of food and its role, you're not seeing things. That's true. That's exactly what they did. That's what Coke's influence produced. And it's disgusting. So the promotion of Coke-sponsored research networks and health initiatives, the email exchanges demonstrate how Coke used these 2 conferences in 2012 and 2014 to promote their agenda. Applebaum wrote to Professor Kaczmarek, encouraging him to submit an abstract for both of the conferences. The agenda and abstract booklet show that his name was selected to give a presentation at 2012 and was the co-author of an abstract for the 2014 event. Coke also used their front group as a platform to promote exercise as medicine. As its name suggests, it advocates the idea that physical inactivity is central to obesity and type 2 diabetes, a message that aligns with Coke's overall scientific agenda. In an email exchange about ideas for the conference in 2014, Applebaum, remember that's the Coke representative, wrote this. Also thinking of a pre-conference workshop for exercise is medicine. If there's necessary time with the global mix, it's a great opportunity to drive awareness, hopefully support with more countries involved. Currently up to 40 countries, only 167 more to go. So this isn't just America. This is around the world. And let's not forget these big food companies, they have major influence around the world. I'll never forget 2015. I was asked to speak in South Africa at a big conference in Cape Town, South Africa. Professor Noakes had a group of us from all over the world come in. I was like the one layperson. It was Dr. Jimmy Moore, Doctor. It was kind of funny. But they had us come in. And so when the conference was over, they took us to the outskirts because Cape Town in the main area is just gorgeous and it's wonderful. You go on the outskirts of town, we think we see poverty in America. They have poverty there. But the thing that was disturbing to me was there was wall to wall fencing put up all around this neighborhood we were in, and it all had the Coca-Cola label and logo. And I'm going, what in the world? Oh yeah, they came in and they said, hey, we'll fix up your area if you'll let us put these signs up. And so that's how they infiltrate. Even in the poorest of poor countries like that, they'll infiltrate. There's one section in Australia that's that way as well. It's an Aboriginal section, and they were hurting financially. Coke came in and said, we'll throw you a bunch of money, but put up the billboards for Coca-Cola. And that's exactly what they did. They did that in Australia. They did it in South Africa. And now they use their money and their influence to heavily propagandize so that takes the focus off of Coca-Cola. Like when I was a kid, Coke was a thing. Of course, they used to have the little 6-ounce bottles. Then it became the 10-ounce bottles. Then it became a 12-ounce can. Then became a 16-ounce bottle. Then it became a 20-ounce bottle. Now it's a 24-ounce bottle. It's just they keep getting bigger and bigger. And then they wonder, why have we gotten more obese, more unhealthy? It's no surprise to anybody paying attention. The email exchanges suggest that Applebaum had a close working relationship with all of the sponsored researchers. They also expose how Coke used that relationship with these researchers as well as the institutions that they represented to promote its scientific and public health agenda. For instance, the emails reveal how Michael Pratt was prepared to deliver his Coke message. Michael Pratt is a public health leader in the area of physical activity and health, having previously served on a variety of public health entities. Additionally, the emails show that Applebaum from Coke had established a relationship with Pedro Halal and suggests that he was supportive of Coke's scientific agenda at the 2014 public health event. Here is what was written. Hi, Peter. Rona and I just had a phone call and decided to have a session all about our sponsorship agreement. The session will last for 90 minutes. I suggest you think about 4 to 5 speakers, 10 minutes each for the session. Applebaum indicated that Coke would provide funding for that session to support the participation in the conference. We'll buy their travel, so full speed ahead. This is where they're using their money, you guys, to have a heavy influence on shifting that blame away from Coca-Cola and other junk food over to calories, over to physical activity as the reason why, or lack thereof, as to why people got obese. At the 2014 conference, both Pratt and Halal were speakers in a symposium about public-private partnerships, in a symposium titled, Is the Elephant Still in the Room? What's Next After the Publication of the Lancet Physical Activity series? That was something that came out in 2012. It explored the impact of physical inactivity as the world's major non-communicable disease and included contributions from all of the people that got paid by Coke. Notably, the use of the phrase elephant in the room in relation to public-private partnerships echoed Applebaum's use of that exact same phrase in an email to all the sponsored researchers. Does this make you sick to know that Coke had such a heavy influence on things that happened at a public health conference, which then gets trickled down into the research world, trickled down to your doctor who talks to you about why you've got obesity and disease? Oh, you just need to exercise more. You heard that from a doctor? I think we all have. We've all been judged for not exercising enough. And it's because Coca-Cola is pushing that message into all of these public health leaders who then disseminate information right down to the doctor you talk to at your local doctor's office. Are you getting mad? All right. In the discussion, let's see if there's anything in here. Yes. First, as part of its information and messaging strategy, Coke was seen to select topics to be presented at both the 2012 and 2014 conference, despite publicly saying they didn't. They got caught lying. They got caught trying to shift that blame. They did. Thus, it can be argued that Coke effectively used the conference as a propaganda platform to frame the debate, shape the evidence based on diet and public health related issues through the promotion of all of its sponsored research on physical activity. So when you look at a study, and I do this when I read studies, I look who funds it. And I remember when these studies came out back in that era, I was around, I was looking at all these kinds of things, and I saw the Coca-Cola company paid for research looking at exercise. And I remember at the time, I think I was on Keto Talk or Low Carb Conversation, one of my podcasts where we looked at headlines, and I kept asking the question, what is Coca-Cola doing being involved in physical activity research? But it makes total sense now, right? Anything they could do, and I think I said this at the time, it must mean that they're trying to shift attention away from the sugary swill, because we know how unhealthy that is. But if you say it's all about calories, and you say if they just work it off in the gym, you shift attention. Second, as part of its constituency building strategy, Coke was shown to use these conferences to promote its sponsored research networks and health initiatives, and to establish and reinforce relationships with prominent public health figures. Third, Coke privately criticized a public health advocate using derogatory vernacular consistent with the strategy of opposition, fragmentation, and destabilization. If you said anything bad about sugar, anything bad about junk food and its impact on your blood sugar, your insulin, your inflammation, and obesity, they basically came after you. And I'll tell you a quick little story. When I first started blogging, that was back in 2005, I started blogging. Within just a few months, I had already amassed a pretty good following at that point for a brand new blog. And I was talking a lot about sugar and how it played a role in me becoming obese and da-da-da. I could see analytics of like who came to my website. And I remember looking at the analytics, and there was the Sugar Association. They would check in multiple times a day, scrolling. I could see they'd be on there for hours a day, trying to keep up with what I'm saying about sugar and what people are saying in the comment section. They were watching me. Now that was kind of scary because I was brand new. I'm like, what in the world is the Sugar Association? So I ended up having fun with them and actually called them out, took a screenshot and said, oh, look guys, this Sugar Association is looking at my blog. Wow, little old Jimmy Moore circa 2005 hasn't built a following at all yet, and they're already worried about me. They're running scared, guys. They know the handwriting's on the wall, and it's been on the wall with Coca-Cola. Let's not pretend like sugary swill is the number one thing that makes Coke money anymore. Even in 2012, 2014, when these things were happening, sugary swill had already kind of shifted over to diet sodas and flavored waters and things like that. And today their business model is heavily on those things, but they still sell enough sugary swill that it still could impact their bottom line. And it has impacted their bottom line greatly. Third, Coke privately criticized a public health advocate, said that these findings support previous work that examined how the food industry attempts to shape public opinion and public policy to promote their own interest. This study highlights concerns regarding industry sponsorship of public health, medical, and other scientific conferences. It is difficult to prove or disprove the veracity of self-reported conflict of interest. So whenever you see conflict of interest on a study, you can't prove or disprove if they say no conflicts of interest, but then they got money through a front group from Coke. Can you say that you had a conflict of interest? See, it becomes this chess game of who can move things around the best, who can do the investigative reporting, which is why this study is so cool, because they did it. They looked through 37,000 pages worth of documents to find these 5 pages that prove the point. As this study illustrated, there was a clear difference between their messaging and their PR, talking about Coke, and what was communicated in these internal email exchanges. It was only because of the Freedom of Information request that this was uncovered. However, it can be argued that even in the case of honest disclosures by researchers, corporate influence can still exist in more covert forms that simple conflict of interest disclosures detailing conference sponsorship arrangements are unable to capture. So, if they pay for somebody to do some things and pay for travel, and what if the researcher doesn't disclose that they got that as an in-kind payment? Like, there's just so many ethical things going on here. And this is the kind of shenanigans that allows bad research to take place. This is the kind of shenanigans you wonder, oh, why doesn't everybody know Coca-Cola is bad for them? Well, the reason is Coca-Cola is paying off all the people that could talk smack about them, right? Now, I could talk smack about them, but I'm just a layperson. I see my buddy Abel James just came on here. Abel could talk about it, the Fat Burning Man, on his podcast, but it's not the same as a researcher or someone speaking at a big public health conference saying the exact same things. That would have heavy weight, and they know it. Coca-Cola knows it. That's why they're willing to spend all that money. Another related concern is how the food industry uses the practice of sponsoring and disseminating research at these scientific conferences to consolidate its power. That is, the power to influence the political process through the shaping of norms and ideas. There is no reason why Coca-Cola needs to be in the business, so to speak, of shaping public health policy. I don't want Coca-Cola telling me how to be healthy anymore. Why I want the Grim Reaper telling me how to be healthy. They only have one job. Grim Reaper's to kill you, And Coca-Cola is to sell you sugary swill, right? At the end of the day, that's their goal. At everything that they do, this is a marketing ploy. You buy off all the researchers that could talk smack about you, you're going to sell more sugary swill because you hide from the public the truth. It also gives legitimacy of industry sponsors and their views, especially when the corporate messaging can be organized by an authoritative figure. Such legitimacy is an important source of and can reinforce corporate discursive power, therefore strengthening a company like Coke and their ability to shape public opinion and public policy. Specific to the findings of this paper, Coke is shown to use the authority of public health organizations and the respective public health leaders to deliver its message. Therefore, from a discursive power perspective, Coke effectively used the conferences as a platform to bolster its legitimacy in the discussion of public health. And they have no business in that. No business. One potential solution to safeguarding scientific conferences from hidden or less viable forms of food industry influence, as well as to mitigate the potential adverse consequences of bolstered food industry legitimacy within this public health space, is to adopt what we talked about earlier with the tobacco companies, and they controlled them with the World Health Organization Framework Convention on Tobacco Control. Article 1 of that calls for a comprehensive ban on tobacco sponsorship of any form to any event, activity, or individual. Some conference organizers, such as the Public Health Association Australia, have already adopted this approach as they don't want to accept any food industry sponsorship at all. It's important to note that limiting or eliminating food industry sponsors would make it more difficult for some conference organizers to get the necessary funding to conduct the conferences. Well, there it is. If you're having trouble getting funding, you got to find it from some source. And I'm going to call them out. I saw this happen in the keto space. I've seen this happen in the paleo space. I've been around a very long time. I've watched these conferences come and go, and I see certain sponsors at the big level at some of these big conferences, and I go, why did you take money from them? I'll give you one concrete example: exogenous ketones and the big P word company. They gave a lot of money to some conferences, and it was crap. It's just pure crap. And I remember, I got in trouble. I'm going to tell on myself, but I got in trouble at the low carb Denver, low carb, I think it was called Low Carb Vail the very first year. I was in Colorado, and this is several years ago now, 4 or 5 years ago. Low Carb Vail, and one of their sponsors was the Atkins Nutritionals company. And they're the ones that make the Atkins bars and shakes. And I remember they were one of the big sponsors that they had at this inaugural event. And they had a representative from there who got to speak from the platform. And she was focused entirely on the fiber and the protein in their bars. And so when it came time for Q&A, Jimmy Moa raises his hand and says, it's interesting you focus on the fiber and you focus on the protein. Why is there no fat in your bar? Why are the total carbohydrates in the 20s? Why is there junk in your product? Like, it seems to me you've sold your soul to the very people that helped make you, and now you're trying to pretend like that you're a health company that's low carb. Oh my gosh, you could have heard a pin drop. It was so quiet in there. And she was like, as you know, Jimmy being Jimmy called her out. And at the end of it, I got scolded by the organizers. She's like, they were our number one sponsor. I'm like, look, if you have to bring on a company like that to sponsor your event, you need to find other sources of revenue. You do. You don't need to compromise your values of what you stand for by bringing on a company. Would you have a Snicker bar representative at a keto conference? No, you wouldn't. But that's tantamount to what they did. And so, yeah, that was fun. Needless to say, I was never invited back to that conference again. But Jimmy ain't going to shut up. Jimmy's got a mouth and he uses it. For instance, the conference, talking about funding of these conferences, the conference organizers of the 2014 and 2012 events would have needed to find $100,000 to pay for the 2012 one, and $250,000 for the 2014 one. Coke paid those things. While it is beyond the scope of this paper to discuss the organizing of scientific conferences in detail, we argue that solutions such as virtual conferences as a means of lowering costs and increased government funding of public health conferences and research could offset these potential funding gaps. Well, now that we have COVID out there, that's naturally happening. You could easily have a virtual conference, eliminate a lot of those costs associated. You could do it over Zoom. All these researchers that need their travel expenses paid for would have it paid for because they'd be doing it from the comfort of their home, right? And that would be a great solution. A key strength of this paper is that it analyzes data that presents direct evidence that Coke interfered in the scientific agenda and presentations. This paper has two important limitations. Listen to this. First, this research is based on a limited number of communication. Remember, they only got to examine for those specific years, and they went through all 37,000. Second, the email exchanges occurred from 2012 to 2014 and may therefore not be indicative of what's happening now. But the fact is, if they did it in the past and they got away with it, what makes you think that they won't keep doing it until they get caught? Now, maybe, because there were rumblings of this in 2014, maybe that spooked them at that point and they did stop that. In the regard of it may not still be the current practice, further research is recommended to examine the current state of the food industry sponsorship of relevant academic and scientific conferences. That being said, one of the emails revealed that Coke was planning to sponsor events beyond 2014, including the European Congress on Sports Science. Furthermore, evidence from more recent public health related conferences suggests that food industry sponsorship is still widely prevalent. Sure is. So is this a surprise to anybody? I mean, I think any of those of you that follow my work, this is not a surprise. We know big food has a big agenda when it comes to trying to influence what's going on out there. And the saddest part is if they have a heavy influence on public health conferences and all the people involved in that are researchers who are then putting out research papers that are supposedly legitimate science. I talked about this on Monday. If you allow bad science to continue, guess what happens? It breeds more bad science and more bad science and more bad science. You never get good science. It's not good science if it's bad science. We can't get good science if the proliferation of bad science is allowed. And when you allow heavy-handedness from big corporations like Coca-Cola to put their grubby hands all over the research world, what do you expect to happen? I'm disappointed, but at the same time, I love that this is getting out there. I'm grateful to Benjamin Wood, Gary Ruskin, and Gary Sachs for doing this study. Again, go look it up, you guys. International Journal of Environmental Research and Public Health is the name of the journal. And the article, How Coca-Cola Shaped the International Congress on Physical Activity and Public Health, an analysis of email exchanges between 2012 and 2014. All right, I want to see what you guys have to say. We're going to go here first over to Instagram. Usually I would come to Facebook, but Facebook, for some reason, I have swiped, I have looked, I don't see anybody saying anything. I'll see your comments once the episode is over, so go ahead and leave your comments and I'll try to type in responses or like or whatever. So sorry about that, but for some reason I can't see you today. But thank you for being here. But we will come over to YouTube just as soon as we're done with Instagram. Thank you all for being here today on Jimmy Rants. JimmyRants.com is the website. Let's see what you guys have to say on this one. Scott says, I'm insulted. Yeah, we should all be insulted. Holly says, so sad. It is sad that it's come to this. And I wish that more people realized how much of their life is dictated by big business. I mean, again, we're seeing it in a lot of realms of our society these days with social media companies censoring, with basically all kinds of things being shaped in our life by these big businesses that have what they think is lots of power, and they do have lots of money. They wield that power and that money influence over our lives, whether we know it or not. So this is why I don't really like it when I see research that looks a little skewed. I kind of go, okay, who sponsored that? But you can't always, even with that, know that you're getting the real deal of who actually gave the money. Joshua says they should have to put pictures of amputated fingers and limbs on the can. Yeah, they put a warning on a Coca-Cola. Yeah. Joshua says they're trying to push eat less, exercise more. Yeah, that works, right? How long have we heard that message? Just eat less, exercise more. Well, it's all a part and parcel of of Coca-Cola's agenda to put it out there. So, all right, thank you, Instagram. As always, I start on Instagram on Jimmy Rants, by the way. So if you want to follow me on my main channel, it's at Jimmy Rants over on Instagram. But let's pop over here now to my YouTube channel, see what you crazy people have to say. I'm gonna pull you a little closer so I can see you. Good morning. Thanks for being here. People give their toddlers Coke in a baby bottle. Paul, I know. It's effing nuts, he says. Yeah. I remember the first time I saw that, where they put half Coke and then half water to water it down, but they feed their kid Coca-Cola as a baby, and we wonder why they get insulin resistance and grow up to become obese. It's crazy. Can I ask you why you're so fat? Well, thank you. I appreciate that. That's a very sweet comment. I'm fat because you're ugly. There you go. At least I can lose weight. What are you going to do, man? Like, all these years, and I still get those kind of comments. It's amazing. I think I can. Yeah, I sure can. Bye-bye. Shirley says, as much as we already knew they did this, it's disgusting to hear that it's true. Yeah, I think we suspected for the longest time these kinds of things. But yeah, it's horrible that they are doing it, and we know they're doing it, and we can now have evidence that they do it. I thought you were taking off the rest of the year. Well, I did take off for 5 weeks, but I decided to come back earlier. And I've been here for a little bit. I guess I started Monday. I came back Monday, so. Coca-Cola. What are we going to do with them? What we can do with them is let our friends and family know. Beware of what you hear, even from so-called research. Beware of what you hear from your doctor, because people are so trusting of their doctor, or if they hear about a study. And again, like I talked about on Monday, we've been told, trust the science. The science says. Well, what if the science is heavily influenced by industry? Do you still trust it in the same way? How can you? Why would you? So hopefully this gives you a little more context about some of the nutritional health science and physical health science that you've seen come out over the past few years. That's it for this episode of Jimmy Rants. JimmyRants.com is the website. And as always, you can engage live in the content right here. I am Jimmy Rants over on Instagram. So go follow me there. We go live Monday through Friday, 11 a.m. Eastern Time. So thank you so much for being here today. We also have the replay available for you right here on IGTV. Just as soon as this is over, we will pop it up over on IGTV. We also will put it up over on YouTube. If you type in a keyword Jimmy Rants, you will find the show. Finally, JimmyRants.com is how you can see all the past episodes, no matter what happens with the censorship happening all across the internet right now. You'll always be able to see all the past episodes at JimmyRants.com. And tune in tomorrow, you guys. We have Ask Me Anything. I haven't done one of those in a little while. So get your questions ready, and I'll be back tomorrow with more Jimmy Rants, and you can literally tomorrow, Friday, ask me anything you want. Look forward to seeing you, and we'll see you then. Bye.